which Benon, who you saw in the X-ray department, is the one who works. And so we want to upgrade. We want to go to an ophthalmic clinical officer who will have had more training and operate at a higher level, and that will allow us to bring in a bit more sophisticated equipment like slit lamps to do more refined diagnostics. So this is good for the basic screening, but we need to go up a level, and so your help's going to help us do that. And one of the plans is to put some new specialist clinics on the top floor of the rehabilitation unit where we started, where you saw the patients having physio. That building was built with a slab on the top.
Okay.
So it does actually need some extra support, but the plan is to put the extra support and then build on top because we've got limited amount of space. And that's going to give us some specialist clinic areas like ophthalmology, dental. We've got just one dental room at the moment. They do a very good job, but it's small. And then we also want to have ear, nose and throat clinics, which we don't have at the moment. So we're trying to develop so that the patients you've just seen who are seen in general clinics get more specialist support according to their problems.
Okay. So you mean for now Kisiizi Hospital doesn't have a department for ear, nose and throat?
We don't.
ENT.
ENT. We do not have a department for ENT. So what we have is our general team, like Dr. Isaac you just saw. If you have a problem with your ear, you will see Dr. Isaac or somebody like Dr. Isaac, and they will give you some treatment, but they are not specialists in that. So the model we're looking for is that we would initially look for a consultant specialist to come once a month to run a clinic, but that will do two things. It will see some of the patients with those problems that would be referred, but also it will be a training opportunity for people like Doctor that you just saw. It will boost their skills. It will help us to improve the day-to-day things, and then it will gradually develop into a service. For this eye clinic, we want to go to having an ophthalmic clinical officer full-time, and then we will get extra facilities like the slit lamp and things like diabetic retinopathy screening. Being able to look at the blood vessels on the retina gives you an indication of the control of the diabetes, and it helps you to intervene. So it's one of the extra parameters for good diabetic care, is monitoring that side of things as well as the general diabetic control. Because otherwise you may get people going blind who could be avoided, so you're trying to pick things up early. Okay, thank you. So all of this is outpatient. Monday tends to be quite busy, and Tuesday tends to be quite quiet on the clinics as a general rule.